Good afternoon, everyone, and welcome to Community Conversations with Roberta Phillips. My name is Nick. I'm the CEO of Communication and Outreach at the Prince George's County Memorial Library System. So glad to have you with us today. Shout out to Miss Vivian, who is our #1 fan, who someday when we can give away cars like Oprah, will be the first in line for a car like Oprah. And we have a really special guest today. Her name is Donna Phillips. She's the director of the Psychiatric Day Hospital at Anne Arundel Medical Center. And today we are going to be talking all about mental health awareness with some discussion of suicide prevention and also recovery awareness. So I'm going to turn things over to Roberta. Please join us in the chat throughout, and then there will be a chance for a Q&A for both Donna and Roberta towards the end of the program. Thanks so much.
Thank you.
Good afternoon, everyone. I'm glad to be back with you on this cloudy autumn day. I'd like to welcome our guest, Donna Phillips. As Nick mentioned, she is the director of the Psychiatric Day Hospital in Anne Arundel. She holds a master's degree in counseling psychology and is a progressive administrator with over 25 years of experience leading people and developing and expanding healthcare programs. We are so glad that she's here. She's a certified instructor for over 10 years in building healthy relationships between stakeholders and human service settings. So we know that this month has a couple of special awarenesses that we would like to talk to Donna about. One is the National Recovery Month, and also it is National Suicide Prevention Month. Before we get into those categories, Donna, could you tell us a little bit about your work at the Anne Arundel Medical Center?
Sure. First and foremost, I want to thank you very much for inviting me to speak with you. Mental health is a passion of mine. It's very important, especially now during this pandemic. And since I've been at Anne Arundel Medical Center, I've had the privilege of assisting with developing and opening a psychiatric day hospital, an intensive outpatient program, as well as building and opening an inpatient psychiatric hospital. So
that's all amazing, and as you said, much needed, and not just for the pandemic, for everyone's well-being. What are some of the common mental and behavioral health challenges are the community facing right now? Every day is a challenge for a lot of people in a different way, but this pandemic just leads an extra layer. Can you talk a little bit about those?
Absolutely. Timely access to care. If somebody feels as though they need professional help because there's limited resources, the timeliness of getting those appointments is difficult sometimes. So timely access is kind of a challenge. Affordable care. Not everybody can afford mental health services. So that's kind of a challenge for folks. And there's not enough resources, especially for kids. We do offer services at Anne Arundel Medical Center for kids and for adolescents, but there's a need for inpatient beds for adolescents. And there's just overall not enough resources in the community. And then a shortage of psychiatrists throughout the state of Maryland. There's very limited psychiatrists that are available. And there's long wait times in the emergency room, as well as if you want to get an appointment at an outpatient mental health clinic. And then the knowledge of resources in the community. Not all community members have the knowledge of what resources are out there. And lastly, the stigma. A lot of folks do not, they feel like there is a stigma and they don't reach out to get the resources that are necessary.
And how are the community members, and how do people in general, how do we override this stigma? I know, my father probably had some challenges with a mental illness when he was alive, but in that era, it wasn't even talked about at all. And so I think we're, progressing, but I still think, as you said, there's a lot of stigma, and what can we do to erase that stigma and be more inclusive?
So 20 years ago, I mean, we've gone very far, we have, but there's still a lot to go and move forward. 20 years ago, a lot of outpatient mental health clinics were separate, within the community. And so now, and people were afraid to go. So there's been a deinstitutionalization of hospitals. But I think education for the community is extremely important. Education on mental illness, education on how to approach people who are having signs and symptoms. I think that should be the priority in addressing this.
Absolutely. What resources and services are available to Prince Georgians through your organization or provider networks?
So Luminous Health is deeply committed to expanding services in Prince George's County, but only a couple miles away, we have services in Anne Arundel County. And some of those services are Pathways, which is our drug and alcohol program, which provides intensive as well as outpatient program. We have an emergency department that is staffed with mental health clinicians. We have an outpatient mental health clinic, and these are all different levels of care. And it's really important to identify, what that means. So an outpatient mental health clinic is a clinic that provides services to individuals that need medication management with psychiatrists or nurse practitioners, or they need a therapist that they want to see on a weekly basis or bi-weekly basis. So that's our outpatient mental health clinic. A psychiatric day hospital, a lot of people in the community don't really know what that means. And what that entails is we are an intensive program, and we run Monday through Friday. And the program is 6.5 hours per day, and we serve adolescents as well as adults. But they go home during the evening hours. What they do here is they participate in group therapy, individual therapy. We're staffed with psychiatrists, nurse practitioners, therapists, psychiatric technicians. The other thing that we provide is an intensive outpatient program. So if they don't need the 6.5 hours because their symptoms are under management, they want to step down from the psychiatric day hospital, they can go to an intensive outpatient program, which is only 4 hours a day, 3 days per week. And then lastly, we just opened in April a 16-person psychiatric inpatient unit hospital for adults. So there's different levels of care. So if somebody feels as though they are a risk to self or others, they may be evaluated and go to our intensive psychiatric inpatient hospital. If they are having suicidal thoughts and they're not a risk to self or others, they might go to our psychiatric day hospital or our intensive outpatient program. If they just need therapy and symptom management, they might go to a therapist and or a psychiatrist for med management in our outpatient program. So there's different levels.
Okay.
And how do you know which level they are? Normally you would be evaluated by a
Okay. All right. I think, it would be great to have recommendations for folks who are maybe concerned about friends or loved ones. How do we encourage folks that we see are depressed or are not carrying on their normal ways or personality changes occur? How do we help those folks and get them comfortable in seeking treatment?
I'm glad you asked that question, because one of the number one things that comes up is people don't know what to say. So they don't approach them. As well as they don't know the resources. So even if they go talk to them, they're afraid of what they're going to say because
Right.
they don't know what the resources are within the community, and they don't know how to respond to that person. But that's the number one thing that they should do, is they should reach out to that person, and they should speak with them, and try to get an understanding of what they're thinking and feeling. And just, say, something like, I've noticed you've been down a little bit. Would you like to talk about what's going on with you? Establish a rapport with them. Use your reflective listening techniques, your active listening techniques, and really be really involved in the conversation. Be attentive, stay calm, whatever they're saying, stay calm, and respond accordingly. And lastly, just be empathetic, which means, no judgment, just be empathetic, genuine. Empathy denotes understanding, understanding leads to trust, and then trust fosters adherence. So if you make a suggestion like, maybe it sounds like you really need to speak with somebody, they're going to entrust. But the number one thing is to reach out to that person.
And is there still suicide prevention hotlines and such, per se? I don't know, if that's an old concept or if that's still something that is available.
No, there is. It's a National Suicide Prevention Lifeline, which is 1-800-273-8255. And there's some other resources that you can, receive within the community. A lot of people don't know that there's also a crisis response team in Prince George's County as well, too. So if somebody needs to be seen by a mental health clinician, right then and there within their home, they can call the crisis response team. They will go to your home and they will evaluate and assess that person.
That's great to hear. I think, I think there's a real, and we have those numbers scrolling on our screen. I think too, it seems like this isolation that we're having during the pandemic could increase depression and alcohol abuse and thoughts of suicide, because again, if somebody is alone, they don't have that person. So just wondering how, we're looking at National Recovery Month, how some of those things are playing into the scenario with COVID.
It's huge. So we're seeing an uptick. I mean, a majority of the people that come to our programs have a diagnosis of depression and or anxiety. And we have noticed since the pandemic, because of the isolation, that has increased. So their acuity level has increased dramatically because of COVID. And so, we monitor within our programs, we do screenings for depression and anxiety, and we've noticed that their depression might come down, which is great, but their anxiety is still, elevated, because, a lot of people have anxiety because they have no control.
Right.
And there is no end or cure, to this pandemic. It's kind of a chronic condition. So their anxiety continues.
I was just going to say, which is another reason why we should be reaching out, picking up the phone and calling people that we know are isolated, our seniors, folks who live alone, who maybe don't have the mobility to get out. It's kind of silly, but I even look forward to going to the grocery store just so I can see people. So I think any kind of contact and communication is helpful.
Yes, anytime you can reach out to that person, whether it's through social media, whether it's by telephone, even if you're wearing protective gear and you're 6 feet apart, if that's what needs to happen, then yes, absolutely. Because a lot of people are feeling, hopeless, and there's a lot of, they're lonely and they're fearful and they have anxiety. So any which way you can reach out to them would be very helpful.
What are some of the basic tips you can share with community members who might want to assess their wellness situation but may not know where to turn?
So what is really important, just in general, especially now, is taking care of your body. You want to monitor your sleeping regimen. You want to monitor your nutritious diets, exercising, doing things that really boost, your mood and strengthen your immune system. You want to monitor that. You also want to, assess like how much news that you're receiving. On a daily basis, how much are you watching? Because a lot of the news is very depressing. So you want to gauge that. And you want to focus on your stress level. What are you doing to relieve? What activities are you doing to relieve your stress and feel a little bit calmer? Which could be breathing techniques, walking, etc. And again, we talked about connecting with others. And accepting your feelings. A lot of people think, oh, this must be strange because I'm feeling X, Y, and Z, or I'm feeling way more depressed than I've ever. That's fine. Accept them. Your feelings are your feelings. And if they continue, then you might want to assess and see if you should really speak to somebody. And then try positive self-talk. Continuously, a lot of negative things. You watch the news, there's a lot of negative things happening. So if you try self-talk, you kind of reconfigure how your brain is, and it makes you in a better mood. And then try like new traditions. So there's a lot of, Thanksgiving's coming up, Christmas is coming up, you can try different traditions. And I'll give you an example. I have elderly parents that have a compromised immune system. So what we decided, and we're going to actually do it every Labor Day now, is my family and I stayed outside and we bought a projector and a movie, had bonfires at each table, 6 feet apart throughout the yard, and we watched a movie at night with bonfire and had our masks on. It was so nice. And so we're going to do that as a tradition. So, think out of the box and think what you can do with your family members to help.
I saw another similar one, I think it was in a magazine, where they had a pumpkin, and each day a family member wrote something on the pumpkin in a Sharpie marker that they were grateful for. And they started circling the whole pumpkin until it was, completely decorated in words and symbols that brought them joy. And so, mindfulness, I think, is really, really important now. I went to a workshop yesterday, and they started with mindfulness as the entry point, and thinking about things that bring you joy. What does it sound like? What does it smell like? What does it feel like? What might it taste like? It was just a really simple exercise, but it took me to kind of a different, calmer state. So I thought that was really interesting. And also, with the weather starting to turn cooler and, getting outside, I think is just.
So I think both of those, like we do, you can also do, like every night we provide everybody with a journal. And at the end of the day, it's really nice to identify 3 things that were positive that day.
Mm-hmm.
It could be anything. 3 things that were positive that helped you, and why did it help you? You know, and if you do that continuously for 2 weeks, you know, and ongoing, but a minimum of 2 weeks, it really reframes how you think.
Mm-hmm.
You know, and like you said, the meditation, it's the same thing. We actually did a quality improvement, you know, at our day hospital to see how effective that was, doing mindfulness on a daily basis. And it is effective. It really, really helps people to change their mindset and to help them with their anxiety.
Yeah, and I also think, through virtual services, you can, get yoga and meditation, for example, on our YouTube channel at youtube.com PGCMLS, where you can just log in and try some mindfulness, try a yoga class. I think there's a lot of wellness and workout videos out there. We have a service Canopy and Hoopla that you can access with your library card. So a part of it is just, I think, really making an extra effort because of the pandemic. I mean, a lot of these things are normally in our routine, but because we can't go places that where we might normally do this, how do we figure out how to bring it into our homes and make it part of our new routine is probably significant.
And you said a key word, routine, which is really, really important. It's easy with a lot of people staying at home right now to get away from that routine. But it's more important now than ever is to have a routine. And you're right, there's a lot of people, if you can't go in person, they're converting their routine over to, you know, either telehealth and or, you know, doing it on Zoom. So researching activities that help you personally, you know, stay calm, relaxed, you know, help you get through the day is really important. But having that structured routine, whatever that might be, is really important.
And I think it's probably even more important for children and teens too, because their routine of leaving the house to go to school has been interrupted. And so having a schedule, I'm a former teacher, so I know children work really well and thrive when they have boundaries and schedules and routines. So probably that would be something parents would want to do as well.
Yep. Whether it's with anybody, any age group, with anybody, it's really good to have a routine. And every school, I mean, kids are back in school now, but it, for the most part, is virtual. And it's interesting to see, you know, each county does a different way of their schooling and holds students accountable for, you know, in a different way as well too. So it's important to check up on, you know, which way, you know, how structured that really is.
And kind of speaking of kids, what's a good way for parents to talk to their kids during this time? You know, like, I don't know, I would think kids would start to feel like, you know, they might get depressed because they can't see their friends from school or they can't do the things that they normally do. And what are some tips parents can do to really help kids with this kind of unusual circumstance?
Well, my suggestion for parents is that if you see a difference in kind of their quote unquote normal baseline behavior, you know, from a day in and day out, and kind of alters a little bit, then I would be a little bit concerned, and I would sit down and have a discussion with them and engage, you know, what is it specifically that is you know, having them disengage with school or whatever it is that they're off on their baseline. And just have an open discussion with them and reach out to the school system. And, there's usually counselors and a psychologist that might be able to offer support. Maybe there's additional supports within the school system for that. So I know that, there is, for Anne Arundel County, there is a, task force that's looking at that. I'm sure with every single county, there's task forces that are looking at that and how they can support the students. So reaching out to the counselors in the school system and seeing what they're putting in place to help their children, with processing all of this.
And again, I think, like you said, the limit to the bad, negative information for kids is probably even more important now. And again, that's maybe grabbing a book and reading together instead of having that screen time, since we have so much screen time right now anyways. What if you encounter someone who's having a mental health crisis? I think for a lot of people, the first response is to call the police, but that might not be the right idea. I don't know. That's why I'm asking you. What does that look like?
So again, if you experience or run into somebody that's having a crisis at that moment, it's really important for you to reach out, introduce yourself, who you are, listen to their story, ask them, set up the parameters that you really want to help, you really want to listen to them. You'll help them as much as you possibly can. And if you can't, that you will help them get the resources that they need. But you want to listen to what they have to say, because that's what everybody wants to be heard. Everybody has a story. Everybody wants somebody to care. So to reach out to them is really, really important. And then acknowledge what they're saying to you. Paraphrase, what they're saying so they know that you're understanding what they're saying, which helps them engage even more with you. And then recommendations, for taking actions, like have they used, historically, are there coping skills that they've used? Is there something that they can use now until they seek those resources, professional resources? And then lastly, encourage, making a plan. So if they need, to follow up with, seeking a professional help, just let them know, would it be okay? In 2 days, I'd like to follow up with you. Would that be okay with you? To see how they're doing. Now, given pending, what the circumstances is, if it's if they're saying they want to take their life right then and there, it depends on what the situation is.
Sure.
If you see somebody is in distress, it's really important to reach out to them. I would recommend also, I don't know if you've heard of Kevin Hines. Have you heard of Kevin Hines?
I have not.
So he was an individual that, he's wonderful. He's a wonderful speaker. About 20 years ago, he jumped off the Golden Gate Bridge. You know what the survival rate is of jumping off the Golden Gate Bridge? Like pretty much minimal. But he survived. And he tells a story that he woke up, he suffers from bipolar disorder. And he had woken up one morning and the voices were telling him, he had auditory hallucinations. They were telling him, today's the day you're going to kill yourself. And so his father, went to work, said, I love you. He said, is everything okay? And Kevin was like, yep, everything's fine. But it wasn't. And he couldn't tell his father. He got on a bus. The whole time he was crying. The entire time he was on the bus, because he didn't want to die. But, he felt like he had to. He wanted to end the pain. He didn't know how to otherwise. And the folks that were on the bus just was like, what's wrong with him? Nobody asked him. He gets off the bus by the Golden Gate Bridge, walks on the Golden Gate Bridge, and there is a woman. He's still crying. There's a woman there, and instead of saying, can what's wrong? Can I help you? She says, can you take my picture for me? So he did. And he thought, out of all these circumstances, not one person asked, what's going on? Can I help you? And so after he took her picture, he jumped. But he survived. He said, if one person would have asked me, I would have just spilled everything out. So that's how important it is. Every day I wake up, and seriously, I wake up and I'm like, how can I help at least just one person today?
And I think that's a mantra that everyone should have, whether they're a mental health professional or not. I mean, how can just a smile sometimes can make a difference in someone's life. Even just saying, how are you doing today? What can I help you with? All of those simple gestures that seem so insufficient are really, really significant to somebody who needs that human connectedness.
Yeah.
Yeah, I think, and we put the link up for Kevin Hines' story so you can read it online. I think that's really, really interesting. I'm going to see if we have anybody who has any questions for you regarding what we've been talking about. I think there are a lot of resources that, the more we can share resources, the more, and that's what this forum is for. So people know who to call, where they can go. I think that's really, that education piece is so vital.
I do too. Can I suggest two other resources? Okay, so Prince George's does have a crisis response team, and their phone number is 301-429-2185. Also, Shepherd Pratt has a walk-in clinic, and they actually, during the pandemic, now have a virtual walk-in clinic. And so you can call at 410-938-5302, and you can request an appointment. So, if you're unsure of what level of care you need, or you feel like you need to talk to somebody, you can call them as well too.
I'm getting this message that it's kind of thematic through our conversation, is that we just need to help people feel they're not alone.
Support of the community is vital. It really is vital. We offer training called, maybe some of you have heard it, Mental Health First Aid, for adults as well as youth. And it's to help, the general public approach people that are in need.
Yeah, that's amazing. I think it's really important for, again, people to know that. One of the things that is slightly off topic, but it pulls back into topic, is that people need to complete their census, because this directly impacts the healthcare funding that we all get from the federal government. And healthcare funding is so important for not just our physical health, but our mental health. So if you haven't completed the census, I just wanted to remind our viewers you still have time to do that through September 30th, which is fast approaching. Again, we want to make sure through counting you, which everyone is important, that we also are able to fund the services that you all need every day. So just a little shout out to the census folks if you have not done that. Um, the library has also started a health and wellness team, and part of our new strategic framework is helping people to make healthy choices by giving them resources and programming that will provide those sorts of things. So we've been doing some awareness of mental health issues
That's great.
on our programming services, so that people can check in and people can again get the resources they need, talk to somebody who has expertise. And I think that's a major role for the library. We might not have the expertise that someone like yourself or your staff have, but if we can get those phone numbers and those directives out to people so that they can talk to the experts that can help us, that's definitely one of our goals for sure.
That's wonderful.
And then you can always call the library system and we can direct you to resources. But hopefully during this session, people have written down some of these key numbers that you have given out. So that's great. So you're still seeing patients in person, and you've made that adaptation, and you're also doing virtual service. Is that correct?
Correct. So under the behavioral health division, we kind of had to look at each department and kind of, change our process flows a little bit. Although for each department under the division, we are screening everybody. So for our outpatient clinic, the waiting room is like literally your car now. And we do a screening before people come into our clinic, and the staff as well as the patients are wearing masks. At our day hospital, we are doing both virtual and the clinic virtual as well as on-site services, keeping that 6-foot distance. And we're doing it actually at the day hospital consecutively. So there are people on site as well as doing telehealth, which has worked out really nicely. And then for our inpatient, they are here 24/7. So the staff and the patients are trying to maintain that 6-foot distance as well as wearing masks. And some for our inpatient as well as our day hospital, before admission, patients are getting tested for COVID.
Right. Can you tell us what role primary care providers have in screening folks for mental health support?
Pending the primary care office, because there's many of them, but under the hospital, we are doing the PHQ-2 and PHQ-9, which is the depression scale. And so we have also embedded mental health clinicians into our primary care offices over the past course of the past year, as well as we're also using another organization to kind of have an integration of care. So it's really important that not only do we screen them, but also we provide the services if necessary. So it's worked out really nicely.
But it's okay for people to go to the primary care doctor and say, I'm kind of off mentally. I mean, I think the more more information you give your primary care provider, again, they're going to be able to direct you to the resources you need.
So part of the reasons why we embedded mental health clinicians into primary care is because a lot of individuals feel that there is still that stigma about mental illness, and they trust their primary care provider, and they don't want to go to a separate, mental health clinic.
Right.
They want their provider, their, physician to, work with them on their mental health needs, which is perfectly fine, so they do trust their physician to do that, and that's great.
I've been encouraging my staff to take a day here and there if they're feeling overwhelmed with the load of work and maybe caring for children or adult parents. And I think, this pandemic has helped us to realize that sometimes we just need to stop and reflect and take some self-care. I think, if you're caring for somebody who has a mental illness, or you're, just have a lot on your plate, I think it's also important for us to remember self-care, even if we might not be experiencing depression, or, it could lead to that if we don't kind of step back. Can you talk a little bit about that?
Oh, sure, absolutely. Working at the hospital, we've been exposed to a lot of stress.
Sure.
So self-care is really important. One of the things that's been incredibly important, is transparency. What exactly is going on, and having a wellness department has been really great, because they do offer wellness activities like yoga and what have you. And we also have a support group through our clinic for employees as well too. So a therapeutic run by a clinician that employees can go to. But yes, that is really, really important, is individuals' own self-care. So taking time out. It seems, it's really busy at this time. There are many demands on us. We're pulled in 5,000 different directions, trying to figure this out, whether it's our job, because now it's all through Zoom, whether it's our personal life, whether it's trying to get our kids on Zoom for school, or that we're working from home and still helping our kids. We're pulled in many different directions. So it's really important that we take time out and we work and help our own wellness. So each person, has their own way of what relaxes them, what they can do to get themselves involved in activities that relax them.
Absolutely. And I think, too, another thing it's important for people who have employers is most employers have some kind of employee assistance program. And, it's there for you. So reach out if you need that, because, again, this is a very, very stressful, difficult situation we're all in. And I think there is a lot of anxiety about what's going to happen in the future. And as you said, we have no control. So that exacerbates that fear. So I think, those of us which a lot of us do in this county and others, have those services available through our employers. So taking advantage of that is really critical as well.
Absolutely. Yeah, there's a lot of people that don't know that there is an employee assistance program. So we encourage, each person to reach out to their HR department to see if there is one, and what benefits, because there's a lot of benefits that go through that, not just therapy, but there's a lot of other benefits that go through an employee assistance program, and they vary. So, it's really important that they do reach out and find out what services are offered.
Yeah, and I'm sure there's a lot of services that go unused just simply because people don't know about them.
Oh, yeah.
Yeah.
Yep.
And so I think I'm going to see if there's any more questions before we part, but I just want to say that there are resources, as Donna has outlined. There is a National Suicide Prevention Hotline. There are resources in the county, both Anne Arundel and Prince George's, as well as the other counties in Maryland. And I think it's incumbent upon all of us just to kind of reach out and take care of each other during this time.
I agree.
Yeah. Anything else you'd like to share with the audience before we say goodbye for this evening?
If there's ever a question, and a person doesn't know where to turn, certainly, I'm available to speak with whomever. And you can certainly call me directly at 667-204-7311. Just get additional resources and or information.
Oh, that's wonderful. Thank you for sharing that number. That's really helpful. And of course, our last question is always, because we're a library, what are you reading, Donna?
Actually, now that you mention it, I'm doing a training with Dr. Everly, who wrote the Psychological First Aid. Excellent training. Excellent. He's a doctor, and he's from Johns Hopkins, and he's wonderful. Great book.
Okay. And most people know that I am still, let me grab it. I am reading our One Book, One Maryland, The Island of Sea Women. If you want to be a part of our discussions that are coming, you can. And we will also be interviewing the author, Lisa C., on October 1st. So, Donna, if you need a little bit more downtime, it's very good. You can get it from your library.
Thank you.
So thank you for being here. We appreciate all of your help and information, and take care. And we hope everybody in the audience does the same. Take care of yourself and others. All right. Thank you.
Bye-bye.
Bye-bye.